and more newer technology which we are using in the medical field. That is a artificial intelligence. So, on the behalf of the IMA KSP and also on the behalf of IMA JDN, I am welcoming our the President Dr. Veerabhadraya sir for this important program. Welcome, sir.
Thank you, sir.
And also, I welcome our Honorary Secretary, Dr. Surya Raju sir. He is also actively involving and also supporting for us such a program. Thank you for joining, sir. Welcome, sir.
Thank you, sir. Thank you.
And also, I welcome Dr. Madhusudan sir and Karunakar sir and all the members who have joined. Once again, I welcome on the behalf of IMA JDN, Junior Doctor Network. So many of the junior doctors, they have joined in the various medical college, not only from the Bijapur, Ballari, Gulbarga, Raichur, even from the BMC also, many people have joined. And also, I welcome our members, our JDN members also, especially Dr. Mahesh sir and Dr. Priya Balki and Dr. Prasad sir, everyone, without naming everyone, I welcome wholeheartedly for important this program. And not the least, the important, the star of the program, Dr. Prahlad sir, who has accepted our invitation. Last month also we planned, but somehow it is postponed and for the new year. So let us start with this program. And this is important program, that is because every field has a development. As our Prime Minister is telling, the ours is a developing country and India is rapidly developing because of technology. So with the technology, especially the artificial intelligence, every field is developing. In similar way, the medical field also developing in such a way that is transferring the medical industry into the technology, which is helpful not only for the doctors, even every medical science it is helping, including medical engineers. So with this brief introduction, I once again welcome every member for this important program. Now let us proceed to the IMA prayer. I call upon Dr. Surya Raju sir for IMA prayer. Dr. Surya Raju sir.
Just 1 minute, sir. ಎಲ್ಲರಿಗೂ ಶುಭ ಸಂಜೆ. ನಮಗೆಲ್ಲರಿಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸುಸ್ವಾಗತವನ್ನು ಬಯಸುತ್ತಾ, ಮೊದಲನೇದಾಗಿ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆಯೊಂದಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಶುರು ಮಾಡೋಣ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು.
Thank you, sir. Dr. Surya sir. Now I call upon our beloved, the President of IMA KSP, Dr. Veerabhadraya sir, for giving introduction remarks.
ನಮಸ್ಕಾರ ಸರ್ ಎಲ್ರಿಗೂ. ಈ ದಿನ ನಂಗೆ ಖುಷಿ ಆಗ್ತಾ ಇದೆ. ನನ್ನ ಸಹಪಾಠಿ ಕ್ಲಾಸ್ಮೇಟ್ UGಲಿ ಡಾಕ್ಟರ್ ಪ್ರಹ್ಲಾದ್ ಅವರು ಟಾಕ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಅದು ಒಳ್ಳೆ ಸಬ್ಜೆಕ್ಟ್ ಬೇರೆ, ಲೇಟೆಸ್ಟ್ ಸಬ್ಜೆಕ್ಟ್ ಮೇಲೆ. ಸೊ ಇವತ್ತು ವೆಬಿನಾರ್ ತುಂಬ ಚೆನ್ನಾಗಿ ನಡೀಲಿ, ನಾವೆಲ್ಲರೂ ಕೇಳಿಸ್ಕೊಂಡು ಅದನ್ನು ಅಳವಡಿಸ್ಕೊಳ್ಳೋಕೆ ಪ್ರಯತ್ನ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ತಾ, ಐ ವಿಶ್ ಆಲ್ ದ ಬೆಸ್ಟ್ ಫಾರ್ ದಿಸ್ ಪ್ರೋಗ್ರಾಮ್.
Yes, sir. Thank you, sir. Our beloved president has given remarks, and sir is always encouraging and also supportive for the programs. And now I call upon Dr. Priya Balki, madam. Rajan Prasad, sir, anything you want to introduce?
No, sir. Introduction of the speaker.
Yes, sir. Priya Balki, madam. Dr. Priya, madam.
Good evening, everyone. Are you able to hear?
Yes, madam.
Yeah, yeah.
Yes,
Good
madam, you
evening,
can go ahead.
everyone. Yeah, I welcome everyone who are present here today on this platform for the talk on artificial intelligence in medical field. Today, as we are here to find out the answer to the big question in front of us, will AI replace eh, me as a doctor and take away my job? AI in medical field is revolutionizing healthcare by enhancing the diagnostic, personalizing the treatment, and streamlining the workflow. AI tools help us analyze the complex medical data, assist in imaging interpretation, and support the clinical decision making, ultimately improving the patient's outcome and medical research. The key is that AI supports the medical professionals and not substitute them. Skilled doctors who know how to use AI will stay valuable and competitive, while those who ignore it might miss out on the advanced tools. On this note, let me introduce everyone to our distinguished speaker for today, Dr. Prahalad NB. Dr. Prahalad NB is a medical graduate from JJ Medical College, Davangere, Karnataka. He completed his master in surgery in ENT, head and neck surgery from most prestigious institute, PGI Chandigarh. He further honed his skills in advanced ENT surgeries like advanced endoscopic sinus surgery, ear and skull based surgeries, head and neck cancer reconstructive surgery from various prestigious institutes abroad. He has done his MBA in medical and healthcare management from BITS Pilani. He completed his executive management program in strategic management from IIM Lucknow. He did his senior management course in healthcare management from IIM Calicut. He did his advanced certificate course in AI for digital health and imaging program from IISc Bangalore and postgraduate certificate course in technology and innovation from MIT. With over 2 decades of experience, Mr. Prahalad has established himself as a leading ENT surgeon with innovative original surgical techniques like Karnataka flap for mastoid obliteration and also authoring a book on imaging for endoscopic sinus surgery. He has won numerous awards including the Dr. Ralph Cooper National Award and has trained hundreds of young surgeons. Through his association with Rotary International, he has provided free care to over 48,000 patients and conducted over 450 camps in 19 countries. His dedication has earned him the Rotary International Professional Excellence Award. From year 2000, he has started the ENT department at Basveshwara Medical College, Chitradurga, and worked as a senior professor and head of the department. During his time, he has presented many original articles and developed original surgical techniques and won more than 17 prestigious gold medals for his research activities. Since August 2009, he is working as a senior visiting consultant at Brain Super Speciality Hospital, Bangalore. His interest extends to the entire specialty from the dura to the pleura. And today it's a pleasure to have him here as our speaker. I welcome you, sir.
Thank you very much, madam. Yeah. Can I share my presentation, sir?
Sure, sir.
Yes, sir.
Yeah, okay. Uh, Thank you very much, beloved President and my classmate, Dr. Veerbhadraya, and also Secretary Dr. Surya and all other dignitaries, to save time, I'm not going to name each of you. It's really a matter of great honor for me to share some of my small little knowledge with you all this evening. Okay, now there's a big question, as Madam said, and that has been reverberating time and again, whether AI is going to replace the doctor. Believe me, I've been working in artificial intelligence field for now about 6, 7 years. Take it from me. The artificial intelligence will never replace any doctor in our country. Okay. But it will, the doctors who are trained in artificial intelligence slowly, gradually replace the other doctors which are not trained in the future. Okay, this is for sure. Because now, as you are all aware, the a huge summit, international summit, AI summit is happening in Delhi. Yesterday, our beloved Prime Minister, he inaugurated the program, AI summit, which is happening at the Bharat Mandapam. And also, I'm happy to share one of the product which we had produced related to AI that is being showcased there. And our beloved Prime Minister, he visited our booth and appreciating our work. I mean, coincidentally, I'm sharing that. So it is imperative that all of us subsequently we should get trained this in technology. We don't have to undergo a lot of computer programming as training, such training. We will get to use these tools through mobile and various other resources as we progress. So that's what I'm going to speak to you today. Okay. And at the AI summit, so this is what being discussed by different countries, UK, European Union, China, and US, each say we declare that artificial intelligence poses potentially catastrophic, you know, this thing, risk to the humankind. But what they say that is, and I cannot wait to develop it first. So every country is trying to develop the artificial intelligence first, and they're trying to be first among the equals. Okay, so that is automatically it says we being India country with lot of talent, mainly the talent pool as far as the IT concerned, we can definitely have an edge compared to the other countries. So our minister, union minister, he made a statement yesterday. He said, Piyush Goyal, he said India can become the talent capital of the world with artificial intelligence. Okay, because we produce maximum number of software engineers and we export them. Now that because of various geopolitical issues, a lot of engineers are coming back. I'm sure the AI will get the artificial intelligence will get a big boost. For example, you must have you if you are a stock trader, if you're investing in the stock market, you must be aware that recently the Anthropic company they released the Claude software, artificial intelligence software, which could replace the IT engineers, information technology engineers. The moment the news was out, all the stocks, IT related stocks like Infosys, the TCS, Tata Consultancy Services, HCL Technologies, all the stocks they tanked. They went down by almost 10%. So that is the kind of impact we are having. So this AI comes with a lot of power, but there is a saying by this comic character which says with great power comes with great responsibility. Only thing is we should learn how to use it with responsibility. With this, I'm not associated with any AI company, so I have no conflict of interest. This is purely academic presentation. Now I'm going to ask you a question. You can type in, in chat box. Some participants, mainly the students who are there, they can type in the chat box. What does EA stands for? What did we learn in our elementary school? You can type in the chat box. A stands for. Everybody knows. Okay, Apple. See, the moment the A stands for, the it comes to our mind, isn't it? Automatically, this thing. So the moment you say Apple, if you somebody says Apple, in your mind imagination that Apple comes, isn't it? Okay, but for a computer to say this is an apple, we have to feed this information to the computer, the artificial intelligence. It doesn't know on its own. So we don't have to fear for it, isn't it? So it will we have to load this picture to the computer. We have to teach it saying this is an apple, then it will be tabletop. But we as human beings, we once we learn that this is an apple, even if apple is not there in front of you, you just close eye and you say apple, that picture of the apple comes to your mind, isn't it? Okay. So similarly, what does this stands for? I want answers. Let us make it this thing. What does BB stands for? BB stands for, if you guess right, that is basketball, isn't it? See, the ball is okay if somebody has answered, but this is a basketball. So being more specific, isn't it? A human being can immediately recognize it. But if I have to teach this to the computer, I will have to feed all a big number of balls. Then I get to give the specific. This is a basketball because this has such a color and such a line. That's why it's a basketball. So the computer will take quite long time. So what about this? What does C stands for? Isn't it? So irrespective of type of picture which is there, different types of pictures are there of a cat's picture, different cartoon picture. We as human beings, the moment we see this, we say this is a cat, isn't it? But the computer, it's not easy for the computer, okay? Because each cartoon is a different, different type, different picture is there. So we have to feed it, and we have to train it. Then only after that it can come with convincing answer. This is a cat. Okay, that is how the computer will behave. So what is artificial intelligence? Let us define it. Okay, artificial intelligence is nothing but where the computer machines, they think like human beings. They get a capability to think human beings. Can they think on their own? No, we have to feed all the information. Then okay, then we have to ask it based on that information what we fed. Then it can think on this thing. Then within the artificial, there is specific something which gets little autonomy is machine learning. So what is machine learning? It is nothing but a branch of artificial intelligence where initially you fed some information to the machine. After that, it gets some autonomy. It start training itself. Okay, based on the data you have provided, and it will churn it, again and again. It will run a lot of various permutation combinations, and it will learn on its own. That is called machine learning. Then we have something called deep learning, very specific. What is deep learning? It is little advanced and specific type of learning, machine learning, where it is confined to a small area of this thing, but it uses lot of computational power. It uses something called neuronal networks, okay, which is based on like our human beings, the brain, the neural network. That means the several levels of computers are there where they extract each and every single feature, and they come to a conclusion that this is something, what the intended conclusion we can arise. So how is the neuronal network? You know that how our axons and this thing, neurons are made, isn't it? And the same architecture, these computer neural networks are built. So how do they recognize? I showed you this cat's picture earlier. Okay, so the different types of cats are there. So if the computer, depending on different features of that, whatever the cats are there. So each the node in this neural network, which is nothing but a one computer, okay, one which has a special process called graphical processor, because it needs a lot of processing power. So each one studies a separate feature, and it will propagate that to next node, and based on that, each node in the each computer in this neural network, it's go on making a decision. Okay, this is yes or no, and ultimately it will give a answer saying this is what exactly it is. Come to a conclusion. Okay, that is how the deep learning works. So what is all this in based on? Based on something which we as doctors we have already learned. What did we learn? If you remember during computer, during our community medicine postings, third year, we learned something called biostatistics, isn't it? And research methodology. You may remember those biostatistics. If you're a researcher, still, if you're writing a lot of papers, you know that's what is the statistics. Okay. So all this machine learning, deep learning, everything is based on that statistical analysis. It is pure mathematics. Okay. It is pure mathematics. So to be a good artificial intelligence and machine learning engineer, what is essential is the data science. This is also called, in other words, the data science. We need to be data scientists. So we have to go back to our basics and learn this statistical analysis and all this. What is permutation combinations? This artificial intelligence is done on pure data. The probability, you may remember probability. Okay. If you flip a coin, what are the probable chance of the coin getting heads, or what is the probability? Similarly, it is like that based on that probability, and it gives. But one drawback is it needs, all these artificial intelligence based computer machines, it needs lot of processing power. I'm presenting the what I'm presenting. I'm presenting a very high power laptop. It is MacBook Pro. It has 24 core CPU. Okay, and this one, and it has 76 graphical interface. The chips, they're not ordinary chips. These are graphical interface NVIDIA chips are there. and the memory bandwidth is 800 GB memory bandwidth, and have a RAM, what we call is a 128 RAM, and it consumes lot of power, and it costs, it's one of the expensive laptops. It costs about 12,000, sorry, 12 lakhs plus to get this. So it uses a lot of power, and it needs a lot of computational power. That's why wherever the data centers are there, in America, a lot of data centers, all these companies like OpenAI, ChatGPT and all, they've developed a lot of huge data centers where this all the information being churned, and they're consuming lot of electricity. Once upon a time, America used to have a lot of electricity, but now they're finding scarcity for electricity. They are searching for energy everywhere. So that is one drawback. So we're going to leave a lot of carbon footprint as we develop this artificial intelligence. Okay. So whatever I'm teaching you today, whatever I'm speaking today, it comes from where I learned. I learned this science from one is Massachusetts Institute of Technology, otherwise Indian Institute of Science, and we have put up a startup called Karnataka Innovative MedTech Startup, through which we are doing a lot of work on this. Okay, with this, I'm going to give you a few examples, case-based examples, how we are using in the artificial intelligence in our ENT field. Okay, otorhinolaryngology. Okay, that is mainly in the diagnosis and imaging. This thing, that's where, see, how does artificial intelligence work is mainly the pattern recognition. What are the patterns? Say, for example, you say, so this is how on a CT scan and MRI, you say this is how see a breast, see on a brain MRI, a brain tumor, how it is seen. And if how do the radiologists learn? They see series of scans, they read the books, and they can, based on that scan picture appearance, they come to a conclusion. Similarly, the machine is fed a series of thousands of images, and based on the patterns, it will see, it will try to recognize and make the diagnosis. So in our ENT field, head and neck cancer detection, nasopharyngeal carcinoma detection, and also thyroid nodule classification, it comes. Particularly now, we also have a mobile app where the oral cavity, the oral cancers, it takes the pictures, and based on that patterns of the pictures, or based on the histopathology pictures, it will give us in the field. It becomes very easy. Suppose you're doing a screening camp where the doctor has not gone, you send just ASHA worker, or a this thing, a field worker has gone. He has gone with the mobile, just mobile and mobile, this AI related application. He just takes the picture, and based on that picture, oral cavity picture, and this app will tell you whether it's a cancer or not, it's a benign lesions or malignant lesions. So it becomes very easy for field. This is how AI is going to help, isn't it? See, we have a huge population. As recently there was a talk saying government of India is opening a lot of medical colleges, increasing the lot of seats. But see our country, it is the distribution of doctors is distorted. I hope you agree with me. Why most of the doctors are concentrated in urban area, and rural area still we don't have good number of doctors, isn't it? So in this scenario, suppose diagnosis of tuberculosis based on the chest X-ray, okay, or oral cancers, okay, like this pap smear examination, all this can help. Okay, and also the ultrasound examination, or the Doppler, color Doppler examination. Based on this, it will, like, this is a thyroid nodule scanning, based on the USG scanning of the thyroid nodules, it will tell whether this is a malignant or this thing, benign. And also predictive analytics and personalized treatment. This is another area. Okay, suppose we do a treatment, we treat patients for chronic rhinosinusitis, or we do cochlear implant surgeries. That is for children born with congenital deafness. We do cochlear implant surgeries, which is a high stake surgery. Or we are operating for chronic suppurative otitis media. Or a patient with chronic suppurative otitis media comes, or patient with obstetric sleep apnea comes. We can predict based on their the clinical features. We can, based on we can either plan a personalized treatment, or we can predict, if we do such a treatment, what are the probabilities of complications or recovery. For OSS particularly, we take all the clinical features with the phenotype, genotype, physiology, all this. Based on that, we can say, we can come to a conclusion. So what kind of OSA obstetric sleep apnea is, and what treatment works or not. That's how AI can tell us quickly. And also we ENT surgeons, we come across a lot of voice problems, be it vocal cord paralysis, or vocal cord lesions, or vocal cord carcinoma, lot of lesions we see. Okay, in a field, this thing where obvious lesion is not seen, we want to assess his voice. So what we record? We record a spectroscopy, voice spectroscopy, and based on this voice spectroscopy picture, the AI can detect whether what kind of lesion patient has, whether it's simple chronic laryngitis or mass lesion is there, or something. It can help us. Okay, this is one case based this thing. Next is, now the big thing is surgical robotics. The Da Vinci surgical robotics. It made a lot of revolution as far as surgery concerned. A lot of corporate hospitals have it now. We have now the Indian Da Vinci, Indian robotics now called Mantra is there. I am working with one of the companies developing one of the economical cheap robotic machine. That's we are working. We have developed a high tech medtech lab here in our place. We are working on it and this thing. So that has the robotics, the artificial intelligence assisted robotics. It is helping in precision surgery, be it thyroidectomy or skull base surgery or abdominal surgery, the onco surgery, in the areas where human hand cannot reach easily, the robotics is helping. Okay, like we particularly micro ear surgeries or skull base surgery, we operate through the nose, through the ear. So the robotics is helping in very, very in a precision way. And also for hearing aid and cochlear implant, I will not go much into this. So we are using this technology, artificial intelligence, to personalize the hearing aid based on hearing loss, or cochlear implants, that is for the people with total deafness or children with congenital deafness. So we can enhance the user experience as far as using AI. Sleep medicine, it is the artificial intelligence is a big way, helping us big way. One is diagnosing the obstetric sleep apnea and personalizing therapy. Because see, whatever treatment you give for obstetric sleep apnea, patient is not going to be very happy. Whether you do surgery or you give a CPAP machine, positive pressure, airway pressure machine you give, it's not going to, patient is not going to be very happy. But based on the prediction by artificial intelligence, we can titrate what exact treatment we are going to give them, and what kind of, we can also predict what are the outcomes, and based on that we can convince the patient, talk to the patient. That is where it helps. Otherwise patient is not going to be happy. This is how a neural network helps in based on patient's apnea hypopnea index. Based on that, we can come to a conclusion. And most important is patient monitoring and remote care. This is something which we have installed in our hospital. Okay, in the post-op, see, sometimes the staff, now the mobiles are there, everybody is glued to their mobile and social media network. Sometimes staff are not monitoring the patient properly. If good staff is there, sensible staff, they will monitor the patients. But is some of the staff, they don't monitor at all. So what the application we have introduced to our monitors is, any change in the hemodynamics, immediately it will send us SMS. And if you don't attend immediately, we also get a call. We also get a WhatsApp message. So now see, we can have sensors. The healthcare trackers are there. You may be using, some of you may be using smartwatch like iWatch or other watch. Now there are sensors for everything, for EEG, electrooculography, and a microphone for the voice also, ECG, and electromyography. Everything we have sensors now. Okay, using different things. The watches are there, helmets are there, glasses are there, chest straps are there, what not. So this makes you know uh, automatic alerts very easy. This is where AI is going to score in a big way. One is variable disease for chronic conditions like diabetes and this thing, hypertension, things like that, mainly stroke-like conditions, like transient ischemic attacks and all that. It can give us immediate alert. It can also alert the relatives if their little relatives are, kith and kins. Okay, and remote monitoring of post-surgical patients, which we are doing now in our hospital. Okay, also AI-driven telemedicine. It can be done. This is what I'm experimenting. I have three assistants in the hospital. Sometimes patients, they demand always I should see the patients. So suppose if I'm outside, I can remotely monitor the patients. I can remotely through Zoom or something, whatever they examine through the endoscope or whatever, wherever I can watch it. I can see it, using the AI related applications. Okay, like this. Okay, so this is how it's helping this thing, and also research and development. Okay, one of the most difficult areas is drug development. Any drug development earlier it used to take anywhere between 10 to 15 years to develop a drug, because it has to go through regulatory and it has to go through the clinical trials. First, developing a drug, that the conceptualization of a drug, that chemical, and bringing it up to bringing it to the market, it is to take a lot of time. But now the artificial intelligence, where it can, it is shortening the drug development, this thing. That's where that big use is there. This is just one detailed how the drugs are being developed. I'm not going to go into that, this thing. And also education and training is going to be the thing next, mainly through the virtual reality, continuous medical education, diagnosing complex diseases, and surgical simulation. See, the future of training, which we are already experimenting, like we have a surgical skill lab in our hospital, and we regularly conduct training programs. And what we are experimenting now is the virtual reality. We can give whatever surgical scenario is there. The future doctors, the way they're going to train is totally different. Okay, not like earlier. Now, when you see, the best training is hands-on training. But for hands-on training, we need cadaver dissection training programs where, our junior doctors can train on cadavers and learn, which is difficult here. We have dearth for such a surgical skill lab, availability of cadavers. Now, even our own medical students are not getting enough dissection exposure, isn't it? They only get a specimens to study. Many medical colleges, no dissection at all. And in Karnataka, only there are one or two institutions where you can go and do those cadaver dissections, like the surgical skill lab in MS Ramaya Medical College and all like this. But in the future, this virtual reality is going to help us in a big way in training our junior doctors. This is something which we are experimenting in our place, the training through virtual realities. Okay, and also speech processing. I will not come to this. Go to this thing. One of the use case scenario I'm going to talk to you about speech processing. What we have done at our institute, the AI related this thing. See, one is the cochlear implant. You may be aware. This one use case scenario example I would like to give. This thing is that is this is give for severe to profound sensory neural hearing loss patients. We use this. This has of that late, there are a lot of expanded indications, but outcomes are highly variable. You cannot predict. Just because you give a cochlear implant, the patient, the child will not hear, because lot of factors they influence the outcomes of cochlear implantness, like cause of deafness, duration of deafness, age at implantation. The best results earlier we do, maybe at the age of 1.5, 2, like that. Okay, cochlear health, and the residual hearing, how much a child has, cognitive and neural factors, motivation and expectations of the patient. And we insert the electrode inside the cochlear to stimulate it. So electrode insertion trauma, any medical health factors, socioeconomic factors, all this, and post cochlear implantation, rehabilitation, we have to train the child. So there are several processes are involved in cochlear implantation. One is starting from pre-op evaluation, counseling the patient, surgery of the patient, then device activation, then mapping, or we have to the stimulation of the cochlea we have to set a stimulation mode that is called mapping, and also rehabilitation later. So this AI can interfere at so many places of the late. We are experimenting the use of AI at various stages. Okay, we did the study at our medical college, which is a tertiary care teaching hospital. We obtained, the permission for four prospective studies. We obtained institution ethical committee clearance, and we developed one speech coding and three predictive analysis studies we did. I'm going to show one study. I'm going to quote that mainly the speech processing strategy, which what we have done. This was a prospective study at our medical college. See, one of the challenges, all these cochlear implant patients, they have to undergo something called auditory verbal therapy. It is very challenging in India because India is home to multiple languages. See, this is a machine hearing. This patients, they have to hear properly, then only the patient can speak. Okay. And we have about 780 languages, 22 scheduled languages, and each language has multiple dialects. Given in any single home, the way people speak also is different, isn't it? Then there are also so many things like in Kannada called onomatopoeia, expressiveness, pair words, foreign words. We say top mail haku ಹೇಳಲ್ಲ, bus top mail hako. Like that we speak, isn't it? So a lot of pair words are there. Hogba, oh, jaldi hog banದ್ಬಿಡೋ. Like this, we pair words we use, and also expressiveness, and also onomatopoeia means the way we speak it, the way we express it. That's the thing. And beside that, we have very limited facilities for therapy of these children, and also these children prolonged therapy they need. Because getting an implant itself is very expensive for the parents. If they're poor families, they have to leave their jobs and get this training, and so hence there are a lot of compliance issues are there. So what we did was we introduced a tailored speech processing approach using artificial intelligence. So I'm not going to technical jargon. I will show you what we did. 1 minute. I have to reshare this in order for you to hear the sound, share sound. Okay. So these companies won't allow us to manipulate their implants. So what we did, we developed another device which will provide the child a a uniform kind of sound to the child, so the child doesn't get confused. It's like, it works like a language translator where whatever language you speak, ultimately you will hear in the language you want. Similarly, whatever way different people speak, the what is delivered is uniform. So how is artificial intelligence and machine learn? We used a recurrent neural network. So how it works? A simple, I have decoded the process. It's a big process. So it starts with data collection. That if we are going to implant in a particular home, so all the surrounding noises we record it. How we record, like different people's 6 months. We left a microphone in their homes, recording devices. We collected the samples with their permission. Okay, with the consent, and we process the data, and we define the model, then we train the model, and we sequence the model, we evaluate it, fine tuned it, deployed, and we use the feedback to further train it. Okay, it was a long process, this thing. For example, I'll show you how are the people speak in a given any home. Listen to this.
Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
That is one of the
Twinkle, twinkle, little star. How I wonder what you are. Up above the world so high, like a diamond in the sky.
Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
Twinkle, twinkle, little star. How I wonder what you are. Up above the world so high. Like a diamond in the sky.
So what our model does is it amplifies, It takes the narrowband signals, fundamental frequencies, and Indian language specific pitch variations, and it converts that, it does all that permutation combinations. But how it is delivered, irrespective of who is speaking, how it delivers to the patient, a child, is like this.
Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
So, when a patient hears in a uniform way, irrespective of the dialects or languages, their learning ability amplifies. Okay.
Twinkle, twinkle,
Twinkle,
Twinkle,
little
twinkle,
star.
twinkle,
twinkle.
Twinkle,
Okay. So this study, we what we did was we validated this. We did something called electrodogram to compare our data with the patient data, and the AML platform. We found that excellent result. This for example, like the study results, we can compare, like without this AI based this thing, and with AI based speech processing, this red color with AI based speech processing, definitely patient, the evaluation, they gave a very good result. Okay. The p value was not very statistically significant, very close to 0.005, but still, it's a small study, but still it was this thing. But compared to the without using artificial intelligence, we had one surprise, unexpected outcome. That is, usually the music appreciation of these patients is not very good. All these patients' music appreciation was excellent. And I'll tell you, auditory verbal therapy, sometimes we have to do up to 2 years. But most of these patients whom we used, they refused after two sittings. They said, we can hear beautifully well. Why do we need this? ನೀವೇನು ಕುಂಡಿಸ್ಬಿಟ್ಟು ಬರೀ ABCD ಹೇಳ್ಕೊಡ್ತೀರಾ ಮೇಡಮ್, ಬೇಡ, ನಾವು ಬೇಡ, ನಮಗೆ ಬೇಡ ಇದು. Patient started telling this. So that was the, for example, I'll show one patient.
ఇంకొకసారి చెప్తాను విను. కల్లు మಣ್ಣు,
కల్లు మಣ್ಣు,
తాయి తందే,
తాయి తంದೆ,
గంటు మూటೆ,
గంటు మూటೆ,
అంద చెంద,
అంద చంద,
అత్త ఇత్త,
అత్త ఇత్త,
సుత్త ముత్త,
సుತ್ತ ముತ್ತ,
మನೆ మట,
మನೆ మట,
ఒల గద్దె,
ಒಲ ಗದ್ದೆ,
ಬೆಟ್ಟ ಗುಡ್ಡ,
ಬೆಟ್ಟ ಗುಡ್ಡ,
ಈಗ ಆಗ,
ಈಗ ಆಗ,
ನಮ್ಮ ನಿಮ್ಮ,
ನಮ್ಮ ನಿಮ್ಮ,
ಬೇಳೆಕಾಳು,
ಬೇಳೆಕಾಳು,
ಅಲ್ಲಿ ಇಲ್ಲಿ,
ಅಲ್ಲಿ ಇಲ್ಲಿ,
ಗೆಜ್ಜೆ ಪೂಜೆ,
ಗೆಜ್ಜೆ ಪೂಜೆ,
ಮೀನಮೇಷ,
ನೀನಮೇಷ,
ಕಷ್ಟ ಸುಖ,
ಕಷ್ಟ ಸುಖ,
ಗುರು ಶಿಷ್ಯ,
ಗುರು ಶಿಷ್ಯ,
ಆಸ್ತಿ ಪಾಸ್ತಿ.
See, this was the patient when he came to us. He was totally depressed. He couldn't hear a single word. But now, forget hearing. He speaks so beautifully, isn't it? That is the result of artificial intelligence. So we are trying to bridge the silence in India with our solution. Only limitation is patient required additional pocket model because companies wouldn't allow meddling with them. And in future, we would like to install this software with the company. This is only a pilot study and limited to South Indian languages. And I just wanted to showcase this, what artificial intelligence can be done. So I don't want it to be too technical on this. I just wanted to show you what can be done, what cannot be done with the artificial intelligence. So if you have any question, I'm happy to answer. And that was this thing. Okay. Any questions? I'm happy to answer.
Yeah, Professor,
Yes,
very-
madam. Yeah. Madam is asking, Priya Balki, madam. Is AI increasing the cost of treatment like robotic surgery costs, like laparoscopic surgery, conventional surgery? So about the affordability. Ma'am, it's just the technology is evolving. Okay. So what happens is, when the technology we come first time, the first timer advantage will be there. Okay. First timer advantage, people try to make money. But once AI is become uniform everywhere available, we can't make it, isn't it? When the demand goes down, okay, the price also goes down. So now when the demand is high, the price goes up, isn't it? That's how the market economics work. Okay. Uh, See, the AI replacing clinical examination and findings, AI will not replace clinical examination findings at all, because whatever decision making it does is on your based on your clinical examination and findings. Okay. Or if at all, if AI, you want AI to do the examination, then you'll have to develop the devices for that. Okay. So yeah, this has to be done with the examination. That's why I tell all my students, that is, all my students, medical students, one tool we have, the tool of the trade is physical examination. Learn the physical examination properly. Do the bedside examination and go to the bedside and learn from that. I tell them. But nowadays, the bedside examination that is slowly disappearing in medical colleges. Sad to say. Okay.
So that is what I
Yeah.
wanted to ask, sir.
Yeah,
Like,
yeah, yeah. Very,
they
very
cannot
important.
replace the
No,
bedside
no, no, never,
examination.
never.
Yeah,
Yeah, yeah.
never. That
And
is what.
missing the diagnosis and
Yeah.
misdiagnosed AI, as of now, the AI is not perfect yet. Okay. We are not going to rely. Say there was Watson computer issue. One issue was there, Watson, they released without trying, testing and trialing, they released a product, for oncology detection. Later, they found that it missed 30 to 40% of the oncology cases. Okay. So the huge fiasco was there. The IBM company which developed this Watson IBM, Watson is called Watson product. They paid huge amount of compensation to the patients. Okay, and now can AI read the radiology photo? Of course, yes. If you're trained it. Okay, as far as chest X-ray concerned, mammography concerned, brain tumor concerned, now we have very good applications. Okay, very good applications. Yes.
What are the medical legal implications of this?
So as far as now, the those rules and regulations are being formulated, but ICMR has already come out with very clear this thing, the guidelines as far as this is concerned, and definitely we cannot quote right away. That is AI-based diagnosis, AI-based this thing. So the clinician's interference has to be there. Yeah.
Sure.
Yeah, AI hallucinations. Do AI do mistakes? It does a lot of mistakes as of now. Okay. So never quote a AI. You use it, you use AI, to get information and this thing, but don't make your decision solely based on AI. Use your clinical intuition, whatever this thing is there.
Dr. Prahlad,
Yeah,
Yeah,
yes,
how
sir.
did you?
Yeah,
Dr.
please, sir.
Surya here.
Yes, sir.
Yes, sir. Yes, sir.
Excellent presentation, sir. Right, I
Yeah.
opened the eyes of every doctor.
Yeah.
Now, what you told is right. AI will not replace the doctor, but
Yes.
definitely doctors with AI knowledge will replace
Yes.
the doctors who are
Yes.
without
Yes.
knowledge.
Yeah.
Do you suggest any institution or online center where the doctors can undergo training artificial intelligence? Do you suggest or recommend any?
So the Indians of Science is running very good course.
Okay.
Okay. But I think they're jam-packed. Now almost every Indians of technology, Indians of management, they have come up with course, healthcare AI courses.
Okay.
Yeah, you just have to go to their website. It is about like, 1 year program, weekly programs. Every Sunday they hold 3 hour lectures.
Okay.
So there are 24-week programs and all are there. Almost all Indians of managements and Indians of technologies, they are doing it. The
Okay.
best course is Indians of Science, but that is jam-packed.
Okay.
This thing, yeah.
Even Google
Even
itself is coming up with the training.
yes, yes. Google is there are a lot of free courses are there, but I'll tell you one free source. I will tell you that is Swayam. That is Indian government's.
Okay.
The Swayam platform. It is totally free platform. There are many courses on that. This thing. It is not the learning AI. This thing is not a very big this thing deal. I'll tell you. We have to learn if we want to become hardcore. This thing we have to learn the Python programming. If somebody has passed biochemistry and physiology, Python programming is child's game. Okay.
Yes,
Once
sir.
we learn that, the other thing what we need is data. In India, that is the biggest issue. Data collection is very poor in India. Maybe the corporate hospitals are maintaining good data now, but I'll tell you, we in the peripheries, doctors write, prescription on some medical shop or pharmacist paper, you know, the prescription or pharmacist, in the down, if you see some pharma name, shop name will be there. In that kind of, they write and send it with the patient. They don't even maintain any documentation, isn't it? OPD patients and all.
Yes,
So
sir.
that way, the data collection in India is not uniform. So that's why, as far as healthcare AI concerned, I don't see that will come too soon to India. I think it will take another 20-25 years because our data collection is very poor. Yeah.
Sir, as you said, the prescription by the doctors, is it AI-based some technology are coming up?
There are many sir, already.
Surgical.
Many are there.
Yeah.
Like, many the voice-based this things are the many are there. Suppose if you are a very busy this thing, you can use these AI tools to automatically write the prescription, take a printout, and many are there. And also now the many AI applications are there, from Indian applications are there. Like, as you examine, go on giving a live comment, it will make a summary of that, and later you can take a printout. So this is very helpful for the busy doctors.
Yes, sir. Nowadays it is coming up.
Yes, yes.
Automatically, it will generate
Sir,
the print
Yeah,
material.
yeah, yeah,
sir,
yeah.
I have a question.
Yes,
Yes,
sir.
sir.
Now that the dissertation work is very mandatory for all the postgraduates,
Yes, yes.
and when they submit the synapses, they use AI, and when they submit the complete
Yes.
dissertation, they produce AI. And some people support that. And what is the stand of the university and NMC as far as use of AI for postgraduate students while completing their dissertation?
Sir, they can use the dissertation for initial research, they can use the AI. But now most of the dissertations also being checked by the universities and for the AI content, how much percentage is there? It shouldn't be more than 10 to 15%. Okay. The research papers acceptance immediately they get rejected if it is the percentage of AI, like earlier they used to check for plagiarism. Now they check for AI. If it is more than 15%, they outrightly reject. I think universities also they're going to adopt this. You can initial work you can do with the AI, but subsequently you have to write in your own words and this thing.
Sir,
But
how it
right now, the universities, nobody is looking into the thesis in detail and all. So they are being accepted. But I'll tell you in future that will be checked because now I'll tell you some of these using these advanced this thing tools like ChatGPT 5.2 and all that, you can write the entire thesis in one day.
Yes, sir.
True, true.
Yeah. Why? And entire without doing single research, without collecting single patient's information, you can write a thesis.
I
But
heard they even declare that we have used the AI.
no, they can say they can declare for we used AI for specific purposes like checking grammar and spelling. That is allowed,
Right.
but not writing the entire thesis.
Sir, how it
True.
is different from plagiarism and this AI?
The plagiarism is you are writing as it is in the
Yes.
in somebody else's book or somebody else research paper. The AI, what it does is it collects all that material, writes its own in this thing. But AI, what it does is it uses terminologies which is common for AI, this thing. If you read that AI generated, you will immediately understand that this is AI generated. So, a student who can't speak even in English properly, if he comes with a beautiful English written this thing, immediately this fellow has not written this.
Yes, sir. Yes, sir. Yes, sir.
Yeah.
The language is different.
Yeah, that makes a difference. And also, you looking at the kind of words used, you will know like this is AI, this thing.
Yes,
There
sir.
are specific words that the AI uses frequently.
Yes,
Based
sir.
on that, you can say. So I write a blog every day. I use AI this thing initially to
Ah,
compose the blog and all. Then what I do, I take it to a software application called Hemingway. I rewrite the whole thing so that it doesn't appear like AI generated. Yeah,
yes.
yeah.
Sir, as you
Dr.
said,
Indira, you can ask your
yeah,
question.
please.
Yes, sir. Sir, Namaste. I'm Dr.
Namaste.
Indira
Yes, ma'am.
from
Welcome.
Dublapur, sir. You
Yes.
were telling about the AI application and the data collection. Sir, AI has been used for the screening of the breast cancer through
Yes.
thermolytics, sir.
Yes.
So that we are done approximately some 3 to 4 thousands of screening at the doorstep of the patients.
Okay.
So we have screened really a good number. I think can be controlled with normal patients and scan reports were compared to them, as well as see in these 2 to 3 thousand people we have got three genuine cancer patients. So
Yeah.
this can be used and the data can be generated well.
Yeah.
And the
Provided.
acceptance is
Yes,
very
sir.
good, sir, with this.
Yeah. I'll tell you, madam, provided you have
Yes,
taken consent from each and every patient, because now the DADP Act has come. Without
yes.
patient's consent, you can't use even single image. You need.
Sir, this is not scan, sir. This is only thermolytics.
That also you have taken patient this thing consent to use to develop AI software or something.
So when
You
we
have to
do the
take.
screening, we get the consent. Like I'm
Yeah,
undergoing
yeah.
this, we
We have to
get the
go through.
consent.
We have to go through the regulation, ma'am. That is
Okay,
the
okay, sir.
Privacy Act is very very stringent. It has become. They are finding huge amount of money for that.
Yes,
Here
sir.
onwards, what you do, whatever you do, you
Yes.
take consent from the patient.
Yes, sir. Yes, sir. That
Yeah. Yeah,
screening
and
consent we are
I'll tell
taken.
you one
Any
thing,
other
data
format,
is the
please let me
king.
know, sir.
If you have so much data, you're the
Yes.
king. If somebody comes to know some AI company, they will be after you for this data and they will pay you huge amount of money also. This is a huge,
That is a
I know,
part.
I'm telling
We
you,
are
I'm
taking
telling
that
you.
to patient's doorstep. That is
Yes,
important,
yes,
sir.
I'm telling you.
Everybody
No,
is
no.
happy and they are coming forward for the
Yes, no, I'm
screening.
telling you, the
Yes,
scenario
sir.
in the country,
Yes.
the lot of these companies, they are searching for data, they're not getting it.
Okay.
Yeah, if somebody come, if one of these companies they come to know that you have so much data, they'll be after you. Okay, but you collected data, you keep collecting. Let's discuss how we can use this. I think
Yes.
this should be we should go through the IMA only and try to make use of this data
Definitely,
and
sir.
develop one application. It's very simple. We have to
Yes.
train we have to classify this model normal, abnormal,
Yes, sir.
and all the abnormal, training. We have to 80-20 per proportion.
Yes.
Training data and testing data. We have to divide it.
Okay. Okay.
We have to train the model, and
Yes.
we have to then next when you do this analytics, the moment you feed that information, it will immediately say normal or abnormal.
Done, sir.
Yeah. We'll discuss that, ma'am. Yeah,
Yes,
yeah,
sir. Definitely.
yeah.
Sir, if
Sure.
there is any format for consent, you just taking the
I
consent
will,
as
I will, I will, I
usual.
will share
Yeah,
that with
please,
you.
please send, sir.
Yeah,
Yes.
yeah. Okay.
Yeah,
Thank you
that's
so much, sir.
important, sir, especially for all the doctors also, sir.
Yes, sir.
Consent formats for different surgery,
Yes. Consent form is very, very important.
elective as well as emergency and grave risk.
Yes.
Everything is very important,
I,
sir.
I, I ask our beloved president and secretaries, I
Yes, sir.
think they should come with this some consent, this thing, some regulations, some this thing, some guidelines. I request them to work on this during their period.
Yes, sir. Yes, sir.
Now that AI and everything is coming, and I think they should sensitize all the members about the consent. Yeah.
Yes, sir.
ಸರ್
Hmm.
ಮಧುಸೂದನ್ ಹತ್ರ ಇತ್ತಲ್ಲ ಸರ್ ಎಲ್ಲ ಕನ್ಸೆಂಟ್ ಫಾರ್ಮ್ ಹಾಕಿದ್ದಾರೆ ಬಟ್
Okay,
ಎಗೆ
okay,
ಸ್ವಲ್ಪ
ma'am.
ಮಾಡ್ಕೋಬೇಕಾಗುತ್ತೆ ಸರ್
I wasn't aware, ma'am.
ಎಸ್
Yeah.
ಸರ್
Hmm.
Yeah. Madhusudan sir ಕೂಡ
So one doubt from like one
Kripa,
Yes,
input
ma'am.
from my side.
Yes.
member of jury.
Hi sir, I'm Dr. Kripa.
Yes, ma'am.
Yeah, madam.
Hello. Yes.
Yes, ma'am.
Sir, I think when it comes to AI, one of the department that is most threatened by AI, I think it is the psychiatrist.
Mm-hmm.
Because nowadays, as far as I've seen, like being from this generation also, I see many of them, they're taking counseling, or they're taking this kind of tips to calm down their mental issues, or any diseases they have from AI. I feel the most threatened department is only psychiatry. How do they actually fight against this AI, to have their place?
If you ask me, psychiatric is something, the pattern recognition is too difficult for AI, because the
Okay.
psychiatric symptoms and this thing is too varied, and unless patient forthcoming,
Yes.
it's not this thing. So more than that, the fields which may be a trouble is mainly the radiology, pathology, microbiology kinds of thing, where the images and those data, hardcore data is there, where it can study the patterns consent. In a different way, it can affect some of these patients is the patient seeking, the idiot syndrome, patient seeking consultation on AI, that is
Yes.
how it can affect. That's what I feel, in my opinion. Yeah.
True.
Yeah.
Yeah, many of the surgeries, sir, especially robotic surgery and laparoscopic other surgeries.
Yeah.
This the as you said, sir, in-depth dissection and something like a calculation, depth of the perception. What you say? So how it is being calculated, and is it safe or is it virtual, sir?
No, no. The this thing concerned robotics is it helps in that is concerned. It helps very much.
Yes, sir. Yes,
Okay.
sir.
Yeah, yeah. It helps a lot.
It helps a lot. Yes, sir.
Yeah, yeah.
Yeah. Any questions? Chat box, sir. Dr. Darshan has.
Yeah, the Dr. Darshana. So the many tools are there, ultrasound images, offhand I can't tell you which there are many image tools are there. If you go on the net and you search, you will get it. Okay.
Sir, once again, any website address, as you said, Swayam, this thing is there.
Swayam is government. This thing is there. You look for, search a net Swayam Government of India Swayam website. You will get it, sir. You register on that, and there are a lot of free courses available on Swayam.
Yes, sir. So
Yeah,
we can
yeah.
train the medical students in regard to this AI.
Yes, yes.
Yes, sir. Yes, sir.
Yeah, yeah. In future, it's going to happen. I think already Indians of Science is starting a medical course. Indians of Technology, Chennai, they are starting a course, integrated course. So, the medical and engineering, they're starting that integrated course, which includes AI and biomedical science concerned. Okay. I'll tell you, I think I foresee that in next 4 5 years, the AI science will become part of our medical curriculum. I'm sure. One of the subject will be introduced in future.
Yes, sir. Yes, sir.
Yeah.
What is the other side of this AI in relation to the medical legal as well as some of the complications, sir?
No, no, as of now, the AI, that kind of use is not there so much. Okay. In
Yes.
India, this thing concerned. But one is you have to, whenever you use AI technology with the patient, you have to explain the patient pros and cons, and they take the consent. Okay. And also, you should document that this is AI based, it is not accurate. Okay. Then you should write your own impression. Yeah.
The media and the TV, everything, everybody they're showing the other aspect also, like a crime or something like a disaster. So a lot of what is the human based anything has happened?
See the catastrophes are happening, and also there is good thing to it also.
Yes,
For
sir.
example, recently the cardiac transplantation was done in Saudi Arabia, completely artificial intelligence, robotic assisted,
Yes,
and
sir.
also now the surgeries are being done remotely
Yes, sir. Yes, sir.
using artificial intelligence. This thing, catastrophes are happening, but they're not coming to the light.
Yes, sir.
Yeah, yeah. They're happening. They have not come to the light yet. Yes.
The robotic even kidney some pyeloplastic surgery has been done, sir, from Hyderabad to the Ahmedabad.
Yes, yes, yes.
Any questions, sir? Raja Prasad, sir?
Sir, is there any question? No.
Yeah, Anuradha Parmesh, madam has joined. Madam will ask questions.
Yeah, good evening.
Yes.
Well, I practice, I have family medicine as well as gynec practice in my clinic.
Yes, ma'am.
And I'm making every sincere attempt to partake in the AI advanced technology because I wouldn't want to be put back. All CMEs and seminars, wherever it's possible, I'm attending, but I'm not enrolled for any serious long course because at 65, I wouldn't want to strain myself with new technology, but definitely I want to be in par with that.
Yes.
So my sincere suggestion to all our youngsters who have logged in, kindly hand in hand, watch how things are. So ultimately, it's just support that we are taking. So we will look at the X-ray report, we look at the lab report, and then we'll correlate with our clinical findings and then come to a conclusion. So we have yet another tool, particularly when it is very confusing for us to with lot of differential diagnosis, AI would help us out is my practical experience. And yours, sir, was a very good presentation. The simplest way that we wanted to know about AI, you have explained, and all your credentials, you have a big, what to say, list of credentials. I
Thank you.
really appreciate the patience that you had to go through all these sessions.
Yes.
Hats off to you, sir.
Thank
Thank
you.
you for that good presentation. Thank you.
Thank you, Madam.
Thank you, Dr. Suresh, for giving, for letting us know about the credentials of
Yes, sir. Yes, madam.
Dr. Prahlad, as well as we did learn a lot from him.
Thank you, madam. Thank you. Our president, sir, is there. Sir, please, your opinion, sir.
It was nice presentation,
Yes,
and
sir.
all questions are well attended. And in future, we have to learn more on AI, and we have to adapt it, I feel. Otherwise, as Prahlad said, if you are not intelligent enough, you will have bad practice tomorrow. So
Yes, sir. Regarding
we
consent,
should,
sir. Yes, sir. Consent.
regarding
Yes, sir. Yes, sir.
consent will make format. Okay, format will say.
On format, sir. Yes, sir.
Yeah, sure.
Yes, sir. I will afterwards. I will ask to Prahlad, sir, how exactly the consent for the different surgeries, especially emergency. What exactly the consent and other things.
I will take this pilot as pilot project. Good that we have got a good stimulation now.
Yes, sir.
I'll go through the ACMR document in detail, and I will prepare a consent and forward it to the president and secretary. Okay.
Yes,
Let
sir.
them take a call. The seniors, they can deliberate on that and take a call on implementing that consent. Yeah.
Thank you.
Yeah.
Madhu, sir. Yeah, Madhusudan, sir. Sir, ಇದ್ದಾರೆ.
ಮಧು ಸರ್ ಇಲ್ಲ ಸರ್.
Okay, out of time, everybody, sir.
Yeah. So if there is
Sir,
no
with our president's permission and Dr. Suresh's permission, I would like to utilize this platform to request all our friends to send email to exclude our profession from CPA. Sorry about it. Thank you.
Yes, madam. Thank you. Yeah, if there is no questions,
Thank you all.
we'll move to the Dr. Kupa. Yeah, Dr.
Yes,
Kupa.
sir.
Yeah, please go ahead for the vote of thanks.
Firstly, thank you all for your patience and the time you have given to go through this amazing topic. And a huge thanks to our speaker. I was first introduced to Sir in the Hampi conference. And one thing I know about Sir is he's a professor, celebrated and appreciated by all his students, staff of his college. And it's a privilege and to give his knowledge. And a huge thanks, Dr. Veerbhadraya Sir, Dr. Raju sir, for always being our huge support and backbone for this organization. And as how can I miss on powers of JDN, Dr. Suresh Kagalkar sir, who's always coming with these innovative ideas and putting all his energy into organizing them. Thank you all the audience participating and putting forth your questions that enhance this event. Thank you all.
Thank you. Thank you, Indra madam. Thank you, Anuradha madam. Thank you, everyone who has joined. Thank you,
Thank you, sir.
John.
Thank you, sir.
Thank you, John, who have engaged in this program. Rajappa sir, also thank you, sir. Once again, everyone who has joined. Dr. Mahesh sir from Tumkur also joined. Thank you, sir. Everyone who has joined, once again, I thank the seniors, dears, and all past chairmen also. Past president also, sir.
Thank you very much. Thank you very much for the wonderful opportunity. Yes, sir. Thank you for all your efforts. Yeah, thank you.
Thank you, sir.
It is being recorded in YouTube also. Once again, who are viewers, they can view the YouTube also. It is there.
Okay.
Yes, sir.
Thank you.
Thank you, sir. Thank you. We'll end up the program.
Thank you.
We'll see you in the